Welcome to In-Silico Trials Real Impact, the In-Silico UK podcast that's revolutionizing the way we think about medical innovation. I'm Professor Alejandro Frangi from the University of Manchester, and I'll be your guide through this fascinating world of in-silico technologies. In each episode, we'll dive into cutting-edge research and groundbreaking news that are shaping the future of medical product development and regulation. From computational modeling to simulated clinical trials, we are exploring how digital approaches are transforming healthcare, making it safer, more efficient, more equitable, and incredibly precise. So, whether you're a researcher, regulator, a member of the public, or a patient representative, or simply curious about the future of medicine, tune in as we unravel the complex world of in-silico methods and their real-world impact. Get ready to discover how computer-simulated trials are leading to very real breakthroughs in patient care. In-Silico Trials Real Impact, where algorithms and data are saving lives. Let's begin.
Hey everyone, and welcome to the Deep Dive. We're diving into AI in healthcare today, specifically the economics of it all as these technologies, become more and more common.
Yeah, exactly. And for this deep dive, we're going to be focusing on a new set of guidelines called Cheers AI.
Cheers AI.
Published in the September 2024 issue of Value in Health.
Okay, Cheers AI. That sounds like a fun acronym, but I mean, this is serious stuff, right? Making sure we're making smart decisions about using AI in healthcare.
Absolutely. Cheers AI stands for Consolidated Health Economic Evaluation Reporting Standards for Interventions that Use Artificial Intelligence. So it's a checklist of 38 items designed to help researchers report their economic evaluations of AI in a clear and standardized way.
So kind of like a quality control checklist to make sure everyone's on the same page when it comes to evaluating these AI tools.
Exactly. Imagine you're a hospital administrator deciding whether to invest in a new AI diagnostic tool. You need to be confident that the research backing it up is solid and that you can compare it to other options. And Cheers AI helps ensure that the information you're using to make that decision is reliable and complete.
Makes sense. But why do we need specific guidelines for AI? Aren't there already guidelines for evaluating healthcare interventions in general?
There are, and Cheers AI actually builds upon those existing Cheers 2022 guidelines, but AI brings unique challenges to the table that require some extra attention.
Like what? What's so different about evaluating AI compared to, say, a new drug?
Well, for one thing, AI systems can be incredibly complex with lots of moving parts. It's not always easy to understand how they work or what assumptions are built into them.
So transparency is key here, right? We need to be able to look under the hood and see what's driving the AI's decisions.
Precisely. And Cheers AI pushes researchers to be much more transparent about how they developed and validated their AI, what data they used, and how they addressed potential biases. This is all critical information for anyone trying to assess the reliability and trustworthiness of an AI tool.
Okay, so transparency is one big difference. What else?
Another key challenge is that AI systems can learn and evolve over time, meaning their performance and potentially their cost can change as they are exposed to more data.
So how do you even begin to evaluate the economic impact of something that's constantly changing? It's not like a static drug with a fixed price and a predictable set of outcomes.
Right, and that's where some of the new items in Cheers AI come into play. For example, there's an item that specifically addresses how researchers should account for the impact of AI learning on their economic models. This helps ensure that we're not making decisions based on outdated information.
Interesting. So Cheers AI is pushing researchers to think differently about how they evaluate AI, given its unique characteristics.
Exactly. It's not just about plugging AI into existing evaluation frameworks. It's about recognizing that AI might require new methods and considerations.
Okay, let's get into some specifics. What are some of the key features of these Cheers AI guidelines that our listeners who are practitioners in AI and in silico medicine should be aware of?
Well, as I mentioned, it builds upon the existing Cheers guidelines, but with some important additions and elaborations specifically tailored to AI. One key area of focus is on the nuances of AI that impact how you choose and apply an economic model.
So it's not just about the AI itself, but also how its unique characteristics influence the entire evaluation process.
Precisely. Another important feature is the introduction of 10 brand new items that are entirely specific to evaluating AI interventions.
Okay, this is where it gets really interesting. Give us a taste of what these new items cover.
Well, one item focuses on user autonomy, which is basically how much control the AI has versus the human in the loop. Is it making decisions on its own, or is it just providing recommendations?
So is it like a self-driving car versus one with driver assist features?
That's a great analogy, and understanding this distinction can help you assess the potential impact of an AI tool on doctor-patient relationships or clinical decision-making processes.
Makes a lot of sense. What else?
Other new items address things like the impact of AI learning over time, how to measure and model its potential to improve its performance with more data. There are also items focusing on development and validation, ensuring transparency around how the AI was created and tested.
So it's about knowing what's under the hood, so to speak, before we trust an AI with important healthcare decisions. What about the practicalities of implementing AI in real-world settings? Does Cheers AI address that?
Absolutely. Cheers AI also encourages researchers to think about potential implementation challenges, such as infrastructure requirements, training needs, and any potential workflow disruptions.
This is all really valuable information, especially for our listeners who are on the front lines of developing and implementing these technologies.
Absolutely. And what's particularly fascinating is that the principles behind Cheers AI could be relevant beyond AI itself.
You mean it's not just about AI? It's about being more rigorous and transparent when evaluating any complex healthcare intervention.
Exactly. The focus on data sources, validation, and implementation challenges could be valuable for assessing other modeling approaches in medicine as well.
Like what? Give us some examples.
Well, the study specifically mentions computational modeling and simulations, sometimes called in-silico trials.
Yes, in-silico trials are becoming increasingly popular, especially in drug development. But just like with AI, there's a need for clear standards to ensure that these models are developed and validated in a way that allows for meaningful comparisons and informed decision-making.
Right, and the principles of transparency, rigor, and thorough reporting that are emphasized in Cheers AI could be easily adapted to provide a framework for evaluating in-silico trials as well.
This is really important for the future of healthcare innovation. As we rely more and more on these complex modeling approaches, we need to make sure we're evaluating them properly so we can be confident in the results. This is definitely something our listeners should be thinking about as they work on these cutting-edge technologies. So Cheers AI is basically setting a new standard for how we evaluate not just AI, but all sorts of complex healthcare interventions.
Exactly. It's about raising the bar for rigor and transparency across the board. Now, one of the most exciting things about Cheers AI is that it goes beyond just the technical aspects of evaluation.
Okay, I'm intrigued. Tell me more.
It also encourages researchers to think about the broader implications of using these technologies in healthcare.
So it's not just about the numbers, it's about the human impact as well.
Precisely. For example, one of the items in Cheers AI specifically calls for researchers to consider the potential impact of their AI intervention on healthcare workers and clinical workflows.
That's really important. We can't just assume that these technologies will seamlessly integrate into existing systems. We need to think about how they will impact the people who are actually using them.
Exactly. And by encouraging researchers to consider these factors early on, Cheers AI can help ensure that we're developing and implementing AI in a way that is both effective and ethical.
This is what I love about the deep dive, getting to the heart of why this stuff matters.
Yeah.
It's not just about abstract guidelines. It's about making sure that these technologies are used in a way that benefits patients and society as a whole.
Absolutely. And I think that's what makes Cheers AI such a timely and important development. It's a sign that the field is taking the responsible development and evaluation of these technologies very seriously.
It's a step in the right direction.
Yeah.
So where do we go from here? What are the next steps in making sure that Cheers AI is widely adopted and has a real impact on the field?
That's a great question, and it's something we'll be exploring in more detail in the next part of our deep dive.
Stay tuned, folks. We'll be right back after a short break.
Welcome back to the deep dive. We've been unpacking Cheers AI and its implications for evaluating AI in healthcare, but now I'm curious to hear your thoughts. What's resonating with you so far?
Honestly, what strikes me is how Cheers AI pushes us beyond just looking at the technical capabilities of AI. It's about considering the bigger picture, the human factors, the implementation challenges, the potential impact on healthcare systems as a whole.
That's a key takeaway for sure. Cheers AI reminds us that it's not enough to simply develop AI that works well in a lab setting. We have to think about how it will actually function in the messy reality of healthcare delivery. And that means thinking about things like workflow integration, data privacy user training, and even the potential for unintended consequences.
Right. It's about ensuring that AI is truly a tool for good in healthcare, not just a shiny new toy that creates more problems than it solves. And I think that's where the real work begins, translating these guidelines into action. So what are some concrete steps that researchers, developers, and even policymakers can take to ensure that Cheers AI has a real impact on the ground?
Well, one crucial step is simply raising awareness of these guidelines within the AI and healthcare community. We need to make sure that researchers understand the importance of transparent reporting and that they have the resources and support to actually implement these recommendations.
So it's not just about having a checklist, it's about creating a culture where these principles of rigor and transparency are embedded in the entire research and development process.
Exactly. And that might involve things like providing training on Cheers AI, developing tools and templates to facilitate reporting, and even incorporating these guidelines into grant funding requirements or journal submission policies.
So making it part of the system, not just an optional add-on. I like that. What about the role of industry? They're obviously a major player in the development of AI in healthcare.
Absolutely. And they have a huge responsibility here. Companies developing AI tools need to be proactive about incorporating Cheers AI principles into their design and validation processes, and they need to be transparent about the limitations of their technologies and the potential risks involved.
Right. It's about moving away from the hype and towards a more realistic and responsible approach to AI development and marketing. But it's not just about researchers and industry. I imagine patients and clinicians also have a role to play in all of this.
Absolutely. Patient engagement is crucial. We need to ensure that patients are informed about how AI is being used in their care and that their voices are heard in the development and evaluation of these technologies.
That means making sure that information about AI is presented in a way that is clear and understandable to patients,
Right.
not just buried in technical jargon.
Right. And it also means creating opportunities for patients to provide feedback on their experiences with AI in healthcare, both the good and the bad. This feedback can be incredibly valuable for identifying potential problems and areas for improvement.
I imagine clinicians are also key here, being on the front lines of patient care. How can they help ensure that AI is used responsibly and effectively?
Clinicians have a vital role to play in several ways. First, they need to be educated about AI, its potential benefits, and its limitations. This will help them make informed decisions about when and how to use AI in their practice.
So it's about empowering clinicians to be thoughtful users of AI, not just passive recipients of whatever technology is thrown their way.
Exactly. And clinicians can also provide valuable feedback to developers on the usability of AI tools, helping to ensure that they are designed in a way that fits seamlessly into clinical workflows.
That makes sense. We don't want AI to create more work or frustration for clinicians. It should be making their lives easier and helping them provide better care.
Precisely. And finally, clinicians have a crucial role to play in educating patients about AI, addressing their concerns, and building trust in these new technologies.
It's all about that human touch, right? Making sure that technology doesn't come at the expense of the doctor-patient relationship.
Exactly. Now, speaking of the human side of things, I think it's important to acknowledge that there are some broader societal implications of AI in healthcare that we need to be thinking about.
Okay, let's dive into that. What are some of the big picture questions that Cheers AI raises?
Well, one key question is how AI might impact healthcare jobs. And the workforce as a whole, will AI replace certain jobs, or will it primarily augment human capabilities?
That's a big one. It's a question that comes up whenever we talk about automation in any field.
Right, and it's important to have a thoughtful conversation about this involving workers, policymakers, and ethicists to ensure that the transition to an AI-powered healthcare system is as fair and equitable as possible.
So it's not just about the technology itself, it's about how we manage the social and economic implications of that technology.
Precisely, another key question is how we ensure that AI is used in a way that promotes equity and access to care.
Right, we don't want AI to exacerbate existing health disparities. We want it to help close those gaps.
Yeah. Exactly. And that means being very intentional about how we design and deploy these technologies, making sure that they are accessible to all populations, regardless of their socioeconomic status, race, ethnicity, or geographic location. We also need to think about how AI might impact the cost of healthcare. Will it make healthcare more affordable, or will it drive costs up?
That's a big concern, especially given the already high cost of healthcare in many countries.
Right, and it's a complex issue with no easy answers. But Cheers AI can help us start to address these questions by providing a framework for evaluating the economic impact of AI interventions.
So it's not a magic bullet, but it's a tool that can help us make more informed decisions about the role of AI in healthcare.
Exactly, and I think that's what makes Cheers AI so valuable. It's not just a set of technical guidelines, it's a catalyst for a broader conversation about the future of healthcare in an age of AI.
It's a reminder that we have a choice in how we shape this future.
Exactly, we can choose to be passive observers, or we can choose to be active participants shaping the development and implementation of AI in a way that aligns with our values and priorities.
And I think Cheers AI provides a roadmap for how to do just that.
It gives us the tools and the framework to think critically about the role of AI in healthcare and to ensure that it is used in a way that benefits everyone.
It's an exciting time to be working in this field, but it's also a time for caution and careful consideration. We need to be thoughtful and deliberate in our approach to AI, recognizing both its immense potential and its potential pitfalls. So as we move towards an increasingly AI-powered healthcare system, it's vital that we keep these broader societal implications in mind.
Absolutely. And I think this is where our listeners as practitioners in AI and in silico medicine have a particularly important role to play.
Okay, I'm intrigued. What do you mean?
Well, you are the ones who are developing these technologies, implementing them, and seeing firsthand how they impact patients and healthcare systems. You have a unique perspective and a responsibility to ensure that AI is used in a way that is ethical, equitable, and truly beneficial.
It's about being more than just technologists. It's about being advocates for responsible AI development and use.
Exactly. And Cheers AI can be a valuable tool in that advocacy. It provides a framework for having those difficult conversations about the ethical and societal implications of AI and for holding ourselves and others accountable to high standards.
It's a reminder that the future of healthcare is not predetermined. It's something that we are actively shaping through our choices and actions. And I think that's a powerful message for our listeners to take away from this deep dive.
Absolutely. So as we wrap up this part of our conversation, I'm curious to hear what's standing out for you, what's sparking your thinking about the role of Cheers AI in your own work.
Well, for me, what's really resonating is the idea that Cheers AI is not just a set of rules or a box to be ticked.
I agree. It's more than that.
It's a call to action, an invitation to engage in a deeper conversation about how we want to shape the future of healthcare with AI. And I think that's a conversation that we all need to be a part of.
I couldn't agree more. So let's continue this conversation in our final part where we'll explore some practical strategies for putting these principles into action and making sure Cheers AI lives up to its potential.
Welcome back to the final part of our deep dive into Cheers AI. We've talked about what these guidelines are, why they're important, and some of the bigger picture implications. But now let's get practical. What can our listeners who are actively working with AI and in silico modeling in medicine actually do to put these principles into practice?
That's the key question, isn't it? It's all well and good to have guidelines, but they're only useful if they're actually implemented. So let's think about some tangible steps our listeners can take.
Perfect, because I know our listeners are the kind of folks who like to roll up their sleeves and get things done. So where do we start?
First and foremost, I think it's about integrating Cheers AI into the entire research and development process, not just treating it as an afterthought when it's time to publish.
So baking it into the DNA of how they approach their work from the very beginning?
Exactly. That means thinking about things like transparency and rigor right from the outset. What data are you using to train your AI? How are you validating its performance? How are you addressing potential limitations? These are all questions that should be considered at the very start of a project, not just when you're writing up the results.
That makes sense. It's about building a culture of responsible AI development, not just checking boxes.
Precisely. And there are practical tools and resources that can help with this. For example, there are reporting templates and checklists available that researchers can use to ensure they're covering all the key elements of Cheers AI.
That's helpful. So there's actual guidance available to make this easier. What about collaboration and knowledge sharing? It seems like this is a pretty big shift in how AI in healthcare is being approached.
It is, and that's why collaboration is so crucial. Researchers need to be sharing their experiences, both the successes and the challenges of implementing Cheers AI. We can learn from each other and collectively raise the bar for the entire field.
So it's about creating a community of practice where researchers are supporting each other in this effort to make AI evaluation more rigorous and transparent.
Exactly. And this community can extend beyond just researchers to include clinicians, ethicists, patients, and policymakers.
Bringing everyone to the table to ensure that we're developing and using AI in a way that is responsible and beneficial for all.
Right, because ultimately the success of Cheers AI depends on a collective effort to shift the culture of AI development and evaluation in healthcare.
Now, I imagine that some researchers might be hesitant to embrace these guidelines. They might see it as extra work or a bureaucratic hurdle. What would you say to those who are feeling a bit resistant?
I'd say that Cheers AI is not about creating more bureaucracy. It's about ensuring that the work we're doing is credible, trustworthy, and ultimately has a positive impact on patient care.
It's about raising the quality and the impact of our work.
Exactly. And I think that's something we can all get behind. And let's be honest, in the long run, adhering to these guidelines is likely to save time and resources by preventing costly mistakes or the need to redo work that wasn't done properly in the first place.
That's a great point. It's an investment up front that pays off in the long run.
Absolutely. Now, another key piece of this is education and training.
Right, because people need to understand what Cheers AI is and how to apply it in their own work.
Exactly. And this education needs to happen at all levels, from students who are just starting out in the field to seasoned researchers and clinicians. We need to make sure that everyone understands the importance of these guidelines and has the skills to implement them.
So it's about integrating Cheers AI into the curriculum of universities, medical schools, and even continuing education programs for healthcare professionals.
Precisely, and beyond formal education, there's a huge opportunity for online resources, webinars, workshops, and peer-to-peer mentoring to help spread the word and provide practical guidance.
It's about making these resources accessible and engaging for everyone who needs them. Now, one thing I've been thinking about is the role of journals and conferences in promoting Cheers AI.
That's a critical piece of the puzzle. Journals can play a huge role by requiring or strongly encouraging authors to adhere to Cheers AI guidelines when submitting their manuscripts.
So making it a standard practice, not just a suggestion.
Exactly. And conferences can highlight work that exemplifies these principles, providing models for others to follow.
It's about rewarding and recognizing those who are going the extra mile to make their work more transparent and rigorous.
Right now, beyond the research community itself, I think there's a huge opportunity to engage the public in this conversation.
I agree. This isn't just an issue for academics and scientists. It's about how we, as a society, want to use AI in healthcare.
Exactly. We need to have open and honest conversations with the public about the potential benefits and risks of AI and about how we can ensure that these technologies are used in a way that is ethical and equitable.
So it's about demystifying AI, making it less of a black box and more of a tool that we can all understand and have a say in how it's used.
Precisely. And this might involve things like public forums, educational materials, and even incorporating AI ethics into school curricula.
It's about empowering everyone to be informed participants in this conversation because ultimately the future of AI in healthcare is something we're all shaping together.
Exactly. So as we wrap up this deep dive into Cheers AI, I'm left with a sense of hope and optimism, but also recognition that there's a lot of work to be done.
I agree. It's an exciting time to be working in this field, but it's also a time for caution and careful consideration.
We need to be thoughtful and deliberate in our approach to AI, always keeping the well-being of patients and the values of our healthcare systems at the forefront of our minds.
And I think Cheers AI provides a valuable framework for doing just that.
It gives us a roadmap for navigating this complex and rapidly evolving landscape, and for ensuring that AI is a force for good in healthcare.
So to our listeners, thank you for joining us on this deep dive. We hope you found it informative and inspiring. And remember, the future of AI in healthcare is in our hands. Let's make sure we shape it wisely.
That's a perfect note to end on. Thank you for listening.